Hello, my name is Dr. Sarwar Chaudhry and we're going to talk about allergic rhinitis or hay fever today. Allergic rhinitis is allergy of the nose. That's a simple definition. It many times is associated with the inflammation in the sinus and is called allergic rhinosinusitis in that way. In terms of its symptoms, the most common are runny nose or congested nose, congested sinuses, postnasal drip where you feel squishing dropping from back of your nose into your throat, frequent sneezing, burst of sneezing, itchy eyes, itchy nose, watery eyes, sometimes redness in the eyes, and many times associated with sore throat, upper airway cough, and sometimes headache. And these symptoms can happen in various proportions in many patients with allergic rhinitis or allergic rhinosinusitis. In terms of its causes, it is an allergic condition. First, before we go into causes, we can divide into two groups. One is a seasonal allergic rhinitis and one is a perennial allergic rhinitis. In seasonal allergic rhinitis, the symptoms happen in particular season, in few months of the year, as compared to perennial rhinitis. In that case, the symptom persists all year long. The causes of seasonal allergic rhinitis are primarily pollens. They may be coming from the grasses or trees, and worse in certain weathers, like in spring when blossom happen. In terms of a perennial rhinitis, the most common culprits are household allergens, which may include dust mite from the mite allergy, and also include pet dander, mold, and animal dander. Like hair from the cat, dog, or even horses, which can cause allergic rhinitis. It may also be associated with asthma, and in those cases there would be symptoms of asthma with cough, wheezing, breathlessness, or chest tightness. It is diagnosed mainly clinically. If we want to know what a particular allergen a person may be allergic to, then we may need to do specific blood test or skin prick test. We may do full blood count, which may demonstrate some increased number of white cells called eosinophils. The total IgE protein may be also elevated in people who've got significant allergic rhinitis. We may sometimes do imaging of the sinuses or sometimes CT scan, but it's not always necessary, and depend on the person, and also depend whether there is any other alternative cause of such symptoms. Treatment depends on what is causing allergic rhinitis. If it's a seasonal allergic rhinitis, avoidance is best. If you have to go outside, wearing a mask can be helpful, or deciding a time when the wind levels are low can also be useful. In case of a perennial allergic rhinitis, it is important to identify the source and reduce the exposure or eliminate the exposure. For example, if there is a lot of dust mite allergy and there are a lot of carpets inside the house, it may be it may be paramount to remove the carpets and put the tiles or wooden flooring to reduce exposure to dust mite. Similarly, if someone has got allergic to pet dander like cat or dog, and they're indoor animals, they may need to be moved outside the premises to help reduce the burden of allergen inside the house. If there is a mold in the surrounding of the house, that needs to be taken care of too. If we talk about medication, there are a few that we can use. If someone's got a periodic seasonal allergic symptoms, in that case you can use only oral antihistamine. If there are persistent symptoms, we may advise in such patients to use nasal medication, which may include nasal steroids, a nasal antihistamine, or combination of both. If patient may have a lot of eye symptoms, then eye medication based on a steroid and antihistamine can or be required. If a patient got one particular allergen, and we could do immunotherapy, which involves giving a small doses of that particular allergen in those patients successively to desensitize patient to such allergen, which can be quite helpful. As I said earlier, it may be associated with asthma, and if there is asthma associated, then it would be paramount to control asthma, which may require inhaler medications. So if you have any symptoms which may suggest allergic rhinitis, we suggest you see your physician and get it checked and further investigation as required. If you would like to know more about allergic rhinitis, you can jump on our website to read the blog about allergic rhinitis. If you have not subscribed to our channel so far, you may do so.